The second session will be handled by Dr. Mohemed Ansar on the topic cardiology. I invite Dr. Mohemed Ansar to the dais.
Respected doctors and friends of homeopathy, I am dedicating this session to our past principal, Dr. S.N. Padiyar sir, and teachers who enlighten us with practical knowledge and brighten up our homeopathic future. Let me dedicate all my achievements of cardiac cases to my father, who have shown the generosity to submit as my first cardiac patient. Homeopathic cardiology is one of the difficult branch of medicine because we had no more previous experiences. With this branch, this is absolutely developed with my own conclusions and criteria from treatment experiences and favorable miraculous results from thousands of cases of various types of cardiac ailments since 1995. This was the first impression about homeopathic cardiology. It is quite natural that there may be frown from various corners when a homeopath died to take cardiac disorders. What is the importance of homeopathic cardiology? Usually, people have the awareness about advanced method of cardiac care. In this situation, how can we convince about homeopathy? Other methods are always leads to huge financial burdens and severe complications and side effects while uses long time. Homeopathic treatments give good results without any complications or side effects. Scope of homeopathy. Which diseases are more effective to treat with homeopathy? One of the main questions among the common as well as from our fraternity. Cardiac conditions effective with homeopathy are coronary artery diseases, rheumatic heart disease, pulmonary artery hypertension, valvular diseases, heart blocks, bundle branch blocks, aneurysms, arrhythmias, cardiomyopathy, pericarditis, and heart failures. We can undoubtedly say that these cardiac conditions could be managed with homeopathic medicine. Common causes and risk factors of coronary heart disease are smoking, stress, hypertension, diabetes mellitus, peripheral artery diseases, obesity, hyperinsulinemia, uric acid, and dyslipidemia. Homeopathic management. Do homeopathy works in heart disease? Yes, we can offer a cure rate more than the so-called modern medicine offered. In our Materia Medica, more than 200 medicines have direct indications to the heart disease. This occasion, I am presenting few cases with evidence of action of homeopathy. First one case. This is a case of coronary artery disease. A male patient presented with chest pain with accumulation of gas, pain radiates to right side of chest, having heaviness on chest, past history of TB, suffered with diabetes mellitus. He approached me when a cardiologist suggested an angiogram. Echo results was normal sized left ventricle, normal left ventricular ejection factor, ejection factor about 65%. No RWMA, concentric left ventricular hypertrophy, left ventricular diastolic dysfunction. And mitral annular calcification results, trivial mitral regurgitation, thickened aortic valve. Conclusions that left ventricular diastolic dysfunction, concentric left ventricular hypertrophy, no RWMA, regional valve motion abnormality. I had given Adonis 30, Lilientic 200, Iodum 1M. Then repeated for 3 months. Then there is some improvement noted. After that, I had given Berberis 30 to control triglycerides and lipid cholesterol. Repeated for a few months with evaluation of blood values, sugar, cholesterol becomes stable. Occasionally check the renal function test, liver function test, sodium and potassium. Then an echo on 8, 10, 18. The result was ejection factor 66, no RWMA, good LV and RV function, valves are normal. After treatment with homeopathy, left ventricular diastolic dysfunction and left ventricular hypertrophy, thickened LV, aortic valve, mitral annular calcification had rectified within 10 months. That is we got with homeopathy. I can give another case. 44 years of old gentleman suffered with severe dyspnea after COVID infection. Had no comorbidity. He presented with obstructive feeling and heaviness at chest while walking. Medical reports from experts show that dilated cardiomyopathy with cardiac failure because he has obstructive sleep apnea, severe left ventricular dysfunction, severe anemia, post-COVID congestive hepatitis. Patient is obese, body weight 112 kilogram. No history of hypertension, coronary artery disease, all complaints started after COVID. Echo shows only 25% of ejection factor. Severe RWMA, dilated LA and LV. Here I had given calcarea as 30, atropine 30, and trinitrotoluene, TNT 200, because there had a tendency to tachycardia or bradycardia. Repeated for 2 months, slightly improved and the suffering, then Tuja replaced by Magnolia 1M. Magnolia is an indicator medicine when severe heart disease affected. Added also aspidosperma tincture 15 drops BD. Repeated the medicines and took an echo on 5/4/22. Then EF increased as 31.28%. Within 2 months, we got this result. Only homeopathy can do like this. Other system was suggested to transplant the heart. That is the only, they can do. That is the treatment protocol nowadays. Now, the patient is good, still the treatment is continuing. Case number 3, a girl at the age of 8 having, this was the end result of that patient. A girl at the age of 8 having congenital heart disease, echo dated 6th April 2018 shows that ASD, left to right shunt, good LV function, no pulmonary artery hypertension. Presented with weakness, emaciation, mouth open during sleep, may be due to adenoids. Obstinate, like sugar, appetite less, weight 20 kilogram. Shouting in sleep, bring her on 17/5/2018. Prescribed iodum, argentinitricum, alfalfa tincture. Repeated for 5 months. She improved her health, body weight 21.8 kilogram. Then iodum 200 has given at night. Argentinitricum 30 TDS. Then her obstinate character, due to her obstinate character, I prescribed Sina 30. Alfalfa and Arjuna had given. I noticed one thing, that she always tried to mislead the parents to get her more attention, suggest them to take an echo, which was 31/1/2019. That is normal. That echo was seen there. Another case I am presenting. This is coronary artery disease with pulmonary artery hypertension. A gentleman with discomfort while in chest while walking and during exertion. Since 1 year, habit of chewing tobacco, anger, mental tension with fear and anxiety. Echo shows that ejection factor 78.8. Left atrium slightly dilated. Angio shows ostial left anterior descending 20% blockage. Mid RCA 30% blockage. I prescribed this cactus and iodum. Also given aconitum to reduce his anxiety. Arjuna tincture and Adonis tincture also given. After 3 months, notice increase of triglycerides and uric acid. Then had given Cardas 30 and Daphne tincture. Medicine repeated. Body weight reduced to 95.5 kilogram. Echo on 18/11/21 shows that good LV function. EF 66.17. No regional wall motion abnormality. Valves normal. No pH. That is why I said the homeopathy can do good result in pulmonary artery hypertension. I am concluding this with much thanks, especially to the organizers of IPH for the privilege gave to me to present this subject in this occasion. And I also thankful all the doctors and homeopathic lovers attend this to hear my words. Thank you. Thank you so much.
Thank you, sir.
This is a wide
In